Thank you and welcome to the show this morning. The topic this morning is cancer, and we're fortunate to have with us this morning to talk about cancer Dr. William H. Hughes, a cancer specialist from Summit Columbia Medical Center in Hermitage, Tennessee. And Dr. Hughes, let me welcome you to the show this morning.
Well, thank you, Dr. Haney. It's a pleasure to be here.
You know, Dr. Hughes, what we'd like to do today is to talk about cancer, and especially talk about your specialty dealing with cancer. But before we do that, let's talk about Dr. William H. Hughes, to get you to give us some information about your background, your education, and some of the other things that were important and eventually leading you to the situation that you're in now.
Well, thank you, Dr. Haney. I'm a native of Conway, South Carolina, and I graduated from Meharry Medical College. There I went into general surgery at Michigan State in Flint, Michigan, and I did my urological training at St. Vincent Health Center and Hammond Medical Center, which are both located in Erie, PA, and part of my training also was at Roswell Memorial Park Institution in Buffalo, New York, and Children's Hospital in Buffalo, New York.
And so you've been involved in medicine since graduation, in terms of specializing since graduation.
That's right, Dr. Haney.
From Meharry Medical College.
Right.
You know, Dr. Hughes, what we'd like to do is to talk about cancer, the topic this morning, and to really get you to give us sort of the layman type of information that we need, which is to say that everybody is familiar with cancer and whatnot, but in terms of identifying and describing cancer and et cetera, let's do that before we get into your specialty, which is prostate cancer. Let's talk about cancer as an issue this morning.
Well, in a layman's term for cancer, I would like to describe it as a little part of you die each day. And a couple of examples of that would be, for most of the audience out there, would be things that shed rapidly. Examples are your hair, which is a quick turnover, and also your skin. If you can sort of focus on that, the shedding mechanisms of everything evolving around your hair, your skin, you lose a little bit every day. So for some reason, and we're not really sure in the medical literature, that what makes cells go awry, it makes them act different from their normal population. And this, over a period of time, we both looked at it at the cellular level and the structural level of cells will change. There are probably lots of things that multifactorial, I would say, that leads up to this. It could be hereditary. I think your genetic makeup has a lot to do with that. What you eat, what you're exposed to, can all cause cancer. Some of the treatments we do can cause cancer. For example, radiation will cure cancer. Radiation also causes cancer. So really, in a sense, we don't know, we have a good grasp, but we don't know all the things about cancer yet. That's why we continue to do research to find out what stimulates a cell, what makes a cell go wrong.
Mm-hmm. Very good. And of course, you've been involved in dealing with this as an issue, cancer as an issue, for a number of years. And your specialty is prostate cancer, I understand. Now, where does that fit within the whole range of cancer? There are many types of cancer. Is that correct?
That is right. And that is a very good question. I think the magnitude for the public in prostate cancer is overwhelming. Prostate cancer is, as incidence goes, is the #1 leading cause of cancer, with the exception of course, of skin. Now, you have other cancers, lung cancer, colon cancer. By and large, lung cancer is the worst of all of them. But prostate cancer, as far as incidence, is higher than even breast cancer in women. So the magnitude of that is paramount, and especially when it comes to the African-American male, because we have the highest incidence with prostate cancer than any race in the world.
Now, why would that be true?